Hi, good afternoon, everyone. It's great to have so many of you joining us today. Some people are still coming in from the waiting room, so we're going to give it a minute before we really get into our forum today. But for those of you who don't know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health, and I'm a member of the Thrive Kentucky campaign. And I don't think I'm the one sharing the screen. So Kelly, if you don't mind advancing that slide, thanks. We just wrapped up a big roadshow with our Thrive Kentucky campaign. We did a 15 region tour around the state with an advocacy training, advocacy for thriving communities, and we had a really good time. It was a lot of fun to be in person again after 3 years. I know some of you were there with us, but we had to put a pause on our monthly webinars and our quarterly forums that we do virtually while we were doing that roadshow. So we're really glad to be back on our regular schedule with the Cabinet for Health and Family Services, and we're looking forward to getting some updates today. On our call today, we have Deputy Secretary Carrie Banahan with us, Medicaid Senior Deputy Commissioner Veronica Judy Cecil, the Director of the Division of Family Support, Todd Trapp, Division of Child Care Director, Andrea Day, Department of Public Health, Deputy Commissioner Dr. Connie White, and the Branch Manager for the Office of Health Equity, Vivian Lasley Bibbs. So very happy to have them with us today and giving us some of their time to share lots of updates. We have an ambitious agenda as always. And our goal with these forums is to create more open dialogue between the cabinet leadership, consumers, and advocates. We really want you to be able to get the latest information on public assistance programs and other parts of our safety net that support families and workers, share feedback, ask questions, and go away, knowing more than you did when you came. I know most of you are familiar with Thrive Kentucky by now, but for those of you who are joining us for the first time, our mission is to meet the basic needs of every Kentuckian through systemic change. And that's because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. So to eliminate those barriers, we focus on anti-racist and anti-poverty policies that will lead to a more equitable and more just Commonwealth for all Kentuckians. You can learn more about our members. If everybody can mute themselves, that would be fantastic. Thank you. We had some logos of our members on the previous slide, and here you can see our shared principles that guide our work. And if we can go to the next slide, Kelly. Here are links to each member organization if you'd like to learn about any of us. And we'll go to the next slide. I am out of practice, y'all. So I said our agenda was up next, but it's not. I want to thank our 2022 Thrive Kentucky sponsors for supporting this work. We really appreciate having so many sponsors that think that the systemic change and the advocacy that we do is important to Kentuckians. And if you are interested in learning more about sponsorship, probably at this point for our 2023 year, you can contact Kelly. Let's go to the next slide. And here's our agenda. So we're going to be talking about a lot today, and just a little bit of housekeeping before we get started. We're recording this webinar as always, and we'll be following up with a link to the recording with any documents or other materials that get shared today. And then if you have questions, as we're going, we're not going to stop and have Q&A at the end of each of these sections. We'd rather you just put something in the chat and we'll try to address it as we go. If we don't get to everything in the next 90 minutes, please just continue to put your questions or your comments in the chat and we'll respond in our follow-up email. We'll try to get written responses to you. So we are going to, oh, and one other thing, again, I'm rusty. Kelly, do we have a slide about CEUs? I should have looked at
the end.
Okay.
Okay. Here,
at the end, we'll have a slide with Kelly's contact information again. If you are a certified CHW or a licensed social worker and you'd like to receive CEUs for today, you can just email Kelly for that. And with that, thank you, Kelly. With that, I'm going to turn it over to Kara and Deputy Secretary Carrie Banahan to talk about House Bill 7.
Hi, like 3 years in, searching for that mute button. I'm Kara. So, House Bill 7 was a huge bill that passed last session that had quite a few changes for a lot of the safety net programs that we focus on, that had changes for waivers for SNAP work and for using self-isolation stations as the last resort, and continuing for CHFS to consider fluctuating income, thankfully, changes to presumptive eligibility and more. And there have been quite a few pieces of the timeline that we've checked in on before. And I don't remember last time what the last spot we hit was. So I'm gonna maybe back up just a little bit and ask our cabinet leadership to walk us through where we are in terms of quite a few of the pieces of that puzzle. Including what's going on with, because of course we had the establishment of the benefits cliffs task force, and the calculator and job posting database, and then we're coming up on the single EBT card feasibility, and lots of exciting information. So I'm going to turn it over to the cabinet to see what they want to throw out, and then we will follow back up with some questions after.
Okay, so I'll talk about a few items and probably defer to DCBS about the EBT card and the SNAP changes that are up and coming. But right now, we're working with the Education and Workforce Development Cabinet, which now is the Education and Labor Cabinet, on the Job Placement Assistance Program. We met several weeks ago, and we're in the process of developing an MOU so we can exchange data between the cabinets. That should be available, the draft, sometime this week. So the Job Placement Assistance Program is voluntary, and it's available to Medicaid enrollees that are between the ages of I believe, 18 and 60. And our plan is to identify those individuals and provide a monthly file to the Education and Labor Cabinet. And they in turn will work with their local career centers to contact these individuals for programs and services that may be available to them. We're also working on the audit of the presumptive eligibility determinations for hospitals. We're determining the number of cases that need to be reviewed. I believe that starts from like January of 2020 up until July 13th. I don't think that's actually due to probably sometime in July, but we're in the planning and development stages. As you had mentioned, the benefits cliff calculator and online job posting database proposals were submitted to LRC September 1st. And then tomorrow, the Benefits Cliff Task Force will be providing their recommendations. So we look forward to that. So is Todd on or Lisa Dennis, and you all can talk about the single EBT card and SNAP?
The timing of that Benefits Cliff Task Force, you all. Today is just like the warm up. We find out the recommendations tomorrow.
Hello, this is Todd Trapp. Hello, I'm the Director of the Division of Family Support, and I can provide an update on the single EBT card. We actually have commissioned a third party to develop that report for us. They've been conducting interviews and compiling data, just so we get a really good third party point of view on exactly what the benefits and the challenges of placing multiple benefits on the same card. That report, that first draft of that report is due to us this Friday. So we're looking forward to seeing that. And we should have time to review that and provide that timely to the legislature. So that's the update there.
This Friday, this week is full of big reveals.
Well, you know, it's Thanksgiving.
I tell you, I mean, sometimes people forget about what a buzzing time November can be. So thank you for that. And we'll all look forward to, and so And that's not like a deadline for the release of a card. That's the feasibility of a card, right? Like whether or not we can do it, what it would cost, hurt, help.
Correct. And this Friday is not a deadline for the report. It's not a due date. That's our due date for the draft, so that we'll have it in time to.
All right, and you all will then
submit a
go back and
report.
forth with it.
Yes, the report is due December 1st, but really that just means within that first week or so of December. So we will have it ready to submit by then.
All right, that sounds good. I mean, these are the things we all want to know. I also want to say welcome to Commissioner Marta Miranda Straub. I think that she popped on after Emily said hello to everyone, and we want to make sure everybody knew that she is here. So, and a reminder that the chat is open. So if you have questions, folks generally are quick about trying to answer those there. And I think that is it for House Bill 7. And I think let's move over to Dustin Pugel of KY Policy for other stuff. TANF, maybe KTAP?
Yeah, that's right. So, hey, everybody, Dustin Pugel, Policy Director with KY Policy. We're going to shift and talk a little bit about the Kentucky Transitional Assistance Program, or KTAP, which is basically just our basic cash program that's a part of the TANF block grant. We've had this program for many, many years. Officially, I think it's been KTAP since about 98, but the rules haven't changed a whole lot since then. We essentially have inherited the same eligibility categories and benefit amounts that we had predating even that. And so what that's meant is that the benefit levels have eroded about 40%. The number of folks who are on the program have plummeted over the last 30 years. And so now we're at a place where we have fewer than 10,000 cases for KTAP. We have fewer than 20,000 people who are using that program. And it's a very badly needed form of income replacement that a lot of folks need while they're working on getting back on their feet, finding their next job. And to put that number in comparison, there's 500,000 people with SNAP benefits. There's 1.6 million people with Medicaid. So we're talking about an incredibly small number of folks. Now, a lot of states have addressed that by improving their regulations and their statutes, even states recently like Mississippi and Tennessee. And so I'm really excited that Kentucky is going to join the ranks of those states and bringing about some really exciting changes. And so we've asked Todd to come on and describe a few of the bigger changes that they're proposing through regulation changes that's required by state statutes. So Todd, why don't you jump in and give us an update on what we're looking at?
Yes, sir. Thank you, Dustin. There's actually two. Let me just start by saying the changes that we are proposing have required, I think, 11 administrative regulations to be revised. And so we've done that in basically two batches, I would say. And so currently they're both going to be on the same approval schedule. They'll both be reviewed by the Reg Review Committee next month. And so that's pretty exciting that once they're approved, that'll have us in I think a spring, late winter, early spring implementation timeframe. So some of those changes, one of the bigger ones is to eliminate the deprivation factor. And as Dustin said, our caseloads have been declining, and the two-parent caseload in particular has really declined. And eliminating this deprivation factor will hopefully encourage and enable more of those two-parent families to be eligible for this benefit. And currently, to be eligible, a two-parent household has to be deprived of support of one parent, either due to incapacity or unemployment. And so eliminating this factor, it doesn't really change any of the other eligibility factors. They still have to meet those other technical factors and the financial factors, but and they'll still have to meet that work requirement currently. but it will just eliminate what really is just an administrative burden to basically make certain connections when it doesn't really change the factors of eligibility. So that's something really good that'll help the process. That'll be a lift on field staff, work in the program, as well as those families who can then access the program more effectively. Another big thing is increasing the income limits. So let's see. We're basically the income limits and the benefit amounts. We're essentially doubling the benefit amounts by household size. So, and because of the way rateable reduction is done, when we make those increases, we also have to increase the income limits and the standard deduction, or else nobody would qualify for that increased benefit amount. So we've made those changes. Another one is increasing the the resource limit from $2,000 to $10,000. This is a big one, and this should help those families remain eligible for a period of time and build some savings, which will be key in them not needing the benefit down the road once they gain employment and try to really improve their family situation. So that's one that I think is a big one. We are also proposing to, and this is one that's aimed at the benefit cliff and helping, mitigate that effect, is increasing we have what's called an earned income disregard. And that is a period of time where we totally disregard the earnings added to a household. So that enables them to increase their earnings or their household income through those earnings and continue to get that benefit for a certain period of time, because we're not counting those earnings in the eligibility calculation. So we're doing that for 6 months at 100%, and then a 50% deduction for those earnings. So basically for 12 months, they'll continue to be eligible for the benefits. If they're in the Kentucky Works program, potentially continue to be eligible for those supports, and then be ready to, then even beyond that, they could still be eligible for the benefit depending on their income level. So I think those are some good change. That's another good change. And let's see. Sorry, I'm got to shuffle my papers around here. We have another program that's called it's a diversionary program. It's for families who maybe are just going through a tough time, some temporary unemployment, something like that. And so they come in and they apply for some help. And if they do that, then we'll screen them, and they could be eligible for something that's currently called it's currently called FAD. We're going to rename it the Short-Term Family Assistance Program. And so we're doubling the amount of that. It'll be potentially $2,600. It'll be short-term assistance to help those families get through whatever that rough spot is currently, and then not need that ongoing benefit. And we're going to expand that program as well. And then we have a relocation assistance program, and this is for KTAP recipients. We're going to double the amount of that and open that up to be available more than once in a lifetime. And that's to help those KTAP recipients who gain employment, or could gain employment, move closer to that job so that it's feasible for them to take that job. So, I mean, those are some of the biggest changes, I think, Dustin. So if we have any questions.
Yeah, there's one question in the chat that I'll ask, and then we probably should keep moving. I think we only gave ourselves 10 minutes for this. One person's asking if there are any talks of removing the child support enforcement requirement in KTAP, and the reason being that some folks are scared off from applying because they are scared that the absent parent, anyway, is that in the conversation at all as a part of this?
That is not part of this conversation, part of these changes. That is feedback that we have heard before, and that is a concern that I know family support has. I think that is something we see as a barrier and as something that prevents certain families from accessing the program. So, but no, that's not something that's on the immediate horizon.
Maybe something to add in the 12th reg change one day in the future. Well, thanks, Tom. I appreciate it. Maybe we can work on answering some questions in the chat. But in the meantime, I think we're headed over to Emily to talk about Medicaid reimbursement for certified community health workers.
Thank you, Destin. Yeah, so we have talked on these forums before about Medicaid reimbursement for community health workers. This is work that's been in progress for a long time. And most recently, after House Bill 525 passed, we got some preliminary updates about what the cabinet was working on to determine, the best reimbursement mechanism for CHWs and how that might take shape. And so we wanted to invite Deputy Commissioner Veronica Judy Cecil back again to give us some additional updates on where they're at right now with this reimbursement plan and what the timeframe is for submitting something to the federal government.
Hi, good afternoon, everyone. My pleasure to be here this afternoon. And actually, I'm coming from Washington, D.C. I'm at the National Association of Medicaid Directors. And I know we're short on time, but just want to let you all know that a lot of conversation here about health equity, about families and children health. And we're hoping to learn a lot and bring back to Kentucky Medicaid. But as far as community health workers, we are working to be in compliance with the legislation, House Bill 525. And we were already considering CHWs, but now we're certainly going to do it to be in compliance. And that means we're going to be filing a state plan amendment. We're going to cover them in those provider types that are outlined within the legislation. We are taking a two-pronged approach. When you look at community health workers, they're both in the clinic, in the office, and then they're out there in the community and providing different services at times. So, and this is something we discovered as we deep dived into the services that are provided by CHW. So what we do plan to do is first roll out a clinical side to this in the state plan, where these individuals will be covered through the providers, and then continue to research and see what's available, what we could do down the road from the community side. I do want to mention, our managed care organizations, most, if not all, have CHWs on staff. They will not, and they'll continue to employ them. And we're putting into our managed care contract the requirement that they have to employ them. That is not a duplication, though, to the services that would be provided by a CHW in the provider's office. So we are moving along. Our date is January 1 for filing the state plan amendment. And we're still kind of working through the logistics of how that implementation looks. And we'll be happy to keep you guys posted on that as we progress.
Thanks, Veronica. It looks like we do have a question here in the chat. It came to me, so I'll read this. Some of us, I was there at the kayak conference just a few weeks ago, the Kentucky Association for Community Health Workers, and Commissioner Lee was there as well. And we heard from Commissioner Lee that there had been some uncertainty about whether Medicaid can reimburse for services outside clinic walls. I think you kind of referenced that with the clinical versus community sort of two-pronged approach. Have you been able to get any sort of clarification or guidance from CMS about how to do this correctly? And, it sounds like you're starting with the first prong, so kind of a two-phased approach, but right. What is the plan for this second phase?
We, in fact, have a meeting here at NAMD with CMS tomorrow. We have what they call office hours, and it's one of the questions that we pose to the CMS representatives, and we hope to have a more discussion about that tomorrow, and hopefully maybe a sense of what we can do going forward. I don't know if our questions will get answered tomorrow, but we're getting ready to have that conversation with them.
Well, that's excellent timing. So if there's anything that you can send us as follow-up, that would be fantastic. I know that as far as I heard after that meeting, that was something that a lot of people raised as a question. And, I think so many community-based organizations employ community health workers now and are doing really critical work in their communities. We just want to make sure that we understand, how they can participate, and if there's, any way that we can be advocating for that, please let us know. We're all happy to send emails or letters or make phone calls to CMS if we need to. It looks like we have
just one other thing. So I do want to stress that the things that we can do in Medicaid and under the state plan, the managed care organizations have a lot more flexibility. And so even if, the first prong, we launched the first prong, there's nothing that prohibits a managed care organization from moving forward and covering CHWs in the community. So that, I think that's something that we can continue to have a discussion with to help see maybe if that's something that can be moved along.
Yeah, and we really do think of this as an equity issue as well. We know that smaller community-based organizations may not, have experience as Medicaid providers, but they are doing similar work. And we want to make sure that if there is a reimbursement mechanism, at some point, and we certainly hope there will be, that the administrative burden of that also won't be so heavy that they can't participate just because it's simply not feasible. So whether that looks like contracting with a Medicaid provider, or I know that there's been some discussion of kind of a community hub that can provide some of that administrative support. Are those the kinds of things that you're considering now?
That's correct. Yes.
Okay. And I see a little bit more in the chat here. Some folks who are working at those CBOs. I'm glad you all are joining us today. And it looks like Liz has shared that at Family Health Centers, they're partnering with La Casita. They're a community-based organization, of course, doing some fantastic work. And I think that access to, health records and billing is really where we want to make sure that we're providing the right support to CBOs. So as you all are continuing to figure out what that second prong looks like, please, keep us in the loop. And if there's a way that we can help to develop that solution, that would be fantastic.
Will do.
I think with that, we can move on to our next speaker, and I have lost track.
I think it's me.
Sarah Stewart.
Yeah, I think it's me. Look at me. I was going to talk over top of you just in case. Keeping up with the documents and the outline, y'all, is not the easiest thing, at least for me. So we're going to talk about Medicaid renewals. And I'm sure everyone, because this is the kind of place where people come who follow things like public health emergencies. So probably not news to people come into this meeting that the public health emergency, the federal public health emergency, was extended. Of course, SJR 150 ended our state public health emergency, which is, of course, preventing federal aid from coming to Kentucky, including over $50 million per month in SNAP dollars. So we go to our grocers and feed our families. Can't let a day go by without reminding people of that. But the federal one is still in existence. And so we've got some time to do some work to prepare for when the federal public health emergency ends, and we have to deal with Medicaid in a different way. So I think that we have got Veronica Judy Cecil here to talk to us about that status and what's going to happen for Kentuckians and what our plan looks like to be ready for when the public health emergency ends.
Thank you, Kara. We, as you all may know, we did not receive the 60-day notice on Saturday from CMS that would have let us know that they do plan to end the PHE in January. So We do then anticipate extension to April, which means that pushes off the earliest termination could happen would be May 1st. We're always grateful for the additional time because it just helps us solidify some of our initiatives around this, including working with stakeholders, which is kind of our next step we're doing right now is trying to engage various provider associations and community organizations and talk with them specifically about what they may need to support the effort around keeping our Medicaid members covered and support them through the redetermination. This is, I know I've said this before, but we have some of our DCBS workers that have never gone through a redetermination, and we have a lot of members that have never gone through a redetermination. So, it's really critical that and important that we make sure that everyone understands what's going on and where to go for help and what next steps are. And so we're really doing an approach that there is kind of no wrong door for somebody to go to understand what's happening. We want providers to understand when somebody walks into their office and, last week was eligible and this week is not. And we want to make sure they know what to do for that person, what they can tell that person and where they can send them for help. And same for our great advocacy organizations like the members of Thrive who are on here today. We know we need your help. And so we want to make sure you all have the information and the tools available to assist those members. So really in this interim, what we've been doing is starting to create those communications and those processes and, what is the best way to assist a member who's going through it. We've just refreshed our data and we see that we have about 250,000 people that are we can't identify within our system whether or not they have income to what their income is and whether or not they will remain eligible. So those are the people we're going to focus on, making sure that we're doing outreach to those individuals. We're planning to send a weekly file to the MCOs about who on their membership is subject to a redetermination and keep them updated as to where they are in that. If we get towards the end of the month, when somebody is about to be terminated, that we want to make sure it's all hands on deck trying to reach that person, get that person's information in if we've made a request for information, and make sure that we can actually do a redetermination. And then again, our priority is for those folks that are going to drop off, maybe due to income, is to do the best we can to smoothly transition them over to a qualified health plan if they are eligible for that. We do recognize that we have about 80,000 people in that bucket of 250,000 that from our system we can tell likely is eligible for QHP. So for us, it's just continuing to try to identify who the folks are. We're gonna do our best to across the 12-month of unwinding, make sure that our caseloads are allocated such that it's not too overwhelming, and that we're definitely allocating the folks that, for instance, might have to sign up for Medicare, but they missed their window. So we're looking at those special populations to make sure that we can outreach to them and help them understand what they need to do next. So those are our activities as of right now.
Veronica, I have a couple of questions. So I heard you say that based on checking sources, you think around 80,000 Kentuckians are going to need to change to a QHP, which means you think around 80,000 folks will likely have income above the Medicaid eligibility line, above that 138 at federal poverty level. Can you explain for us kind of how you all check those sources, like what the process is? I think a lot of folks don't understand like where that comes from.
Absolutely. It's called ex parte or a passive renewal, and our system is able to go out and ping the federal hub and some other databases. And so we can check with the IRS on, income that's being reported. So we have, and we'll be utilizing SNAP eligibility for our Medicaid redeterminations for the unwinding. So it goes out, it kind of pings those federal databases, and based on that, our algorithm allows us to then go ahead when we can verify either no income or we can verify what the income is. Then we have the ability to what's called ex parte redetermine them. The great news about Kentucky is we have about an 80% passive renewal rate. So that means, people that go through that process won't have to do a thing. We'll ping the hub, we'll do the redetermination, and we'll send them a letter saying you're good. So it's really those folks that are going to fall out that, and understand when I say, that 250,000, some of those we just don't know. We won't know until a redetermination whether or not they're going to be eligible. But for the people that we really can see their income, they're either going to be qualified for a QHP, or they may even be too high for a QHP.
Well, too high for maybe tax credit supports that are
Tax
meaningful.
credits,
I mean,
that's correct.
right. Yeah. They
Thank
can
you.
still get
Yes,
a QHP.
APTC. Yes.
Right. Yeah, they can still get that. Do we know, do you all have any ideas about the differences between like kids and adults or urban versus rural that we're talking about here?
So we do have it broken down by county, and we I don't have it in front of me, but there is about 60% that are children, which is, concerning to us. And those were, again, for all these people, we're going to make sure that we've got it right. And we'll do the redetermination when it happens and see what's there.
Okay, thank you so much. I think that's what I've got for that. I think we're just going to stay in touch and keep as a priority discussing how CHWs, connectors, providers, and other community partners can work with y'all to make sure that we keep everyone covered when the PHA ends. We all know that there's a risk. Once someone loses coverage, it's much harder to get them back enrolled. So our goal, I think in Kentucky, I hope everyone can agree, is that we don't lose anyone. We get everybody moved somewhere so they're still actively engaged, so we can have out there Kentucky. And then we have Tyler Offerman of KY Equal Justice here to set us up on PBT and SNAP.
Hello. Thank you, Kara. Yes, my name is Tyler Offerman. I work with the Kentucky Equal Justice Center. Excited to call Todd back up to the plate. This is his third section. You're getting a lot of traffic on this webinar, Todd, so appreciate it. But yeah, there is, as always, a lot going on in the food, feeding, and hunger space. DCBS has obviously been holding down a number of programs across this area, everything from PBT to COVID era policies, some extended, some have gone away, the numerous disaster SNAP programs that have been stood up across the state over recent months, in addition to all the other updates that you've already given, Todd. So again, appreciation to you and your staff for all the work you all are doing. We're going to be talking a little bit about specifically PBT and SNAP. It is not lost on me that we were just talking about the extension of the public health emergency. Kara had mentioned earlier, Senate Joint Resolution 150, which had terminated our state of emergency. And if the public health emergency were to not be extended again, so if it is or if it isn't, I don't have that crystal ball, but if it were to end May 1st, then that would mean Kentucky would have lost out on $650 million of SNAP benefits up to this point. So Todd, interested to know your thoughts on, also work requirements and how those are being impacted by the extension of the public health emergency in the SNAP program. And then any updates you have on the many different PBT plans that we have either gone through or are finishing up, and then ending us out with a little update on the Snap Connector functionality.
Yes, sir. So I guess currently there's something called the ABOD work requirements. I don't know how many on the call are familiar with that, but an ABOD is an able-bodied adult without dependents. And that is a defined individual in the SNAP program that has to meet certain work requirements. It's an hourly requirement, 20 hours a week in what's defined as accountable activity, which can be work or some training or educational activities. And if they're not meeting that requirement, they can only receive benefits for 3 months in a 36-month period when they have in months that they're not meeting those requirements. So during the public health emergency, those requirements are suspended. So we don't have anybody who's losing eligibility based on those time limits and those requirements. Effective the month after the month following the end of the public health emergency, those time limits will go back into effect for any county for which we don't have a waiver. And to apply for a waiver, the House Bill 7 places certain limitations on when the cabinet can apply for a waiver. Basically, the cabinet can determine if certain counties meet certain economic conditions, then we can apply for a waiver for those counties, and then it's up to F&S, Food Nutrition Services, whether they approve that waiver for a county or a group of counties. So we had a waiver approved or have one approved, I believe, through the end of November. And we have a pending waiver request based on a determination for 39 counties that is yet to be approved, but we should get word on that before the end of the public health emergency. And then for those ABOD, those individuals in those other counties will certainly offer the SNAP employment and training program and help them meet their requirement. So that's basically the update on the ABOD time limits, Tyler.
And real quick, just so I can mentally think myself through, which is an unfortunately complicated part of an already complicated program. But assuming the public health emergency does end May 1st, again, not prognosticating, but so a month after, so that would be June 1st, when this would ostensibly go into effect, and that time limit clock would start ticking, and then it's 3 months after that because it's those 3 months. So I guess I just wanted to say that out loud to remind myself that we've got a lot of time to reach clients, talk to them about the impacts, make sure they update any information with your agency as far as address and employment, to make sure that we just to help folks prepare for that.
That's correct. I'm with you on the math there, the 3 months after the end. So.
Great. I don't, any thoughts you have? I threw the top line number, $650 million lost to the emergency allotments, right when we have rising food costs. I don't know if you have any color commentary on that, besides the fact that it is what it is.
And that, refresh me on that. That would be for since the end of the.
Yeah, assuming we still had the state of emergency in effect and it mirrored the federal state of emergency, we're looking down a loss of $650 million to local grocers and farmers through SNAP benefits.
Provided the PHE is extended through May. Yes, I do agree with that. I think that's accurate.
Well, I can stand here and say that is a big old bummer and a grave misfortune upon the people of Kentucky. And I wish I could go back and fix it, but I don't have that power. So moving forward on PBT, 3 buckets here. Looking backwards, how are things looking with the summer EBT and the PBT for kids 0 to 6? And then looking forward, what are things looking like for the 2022-2023 school year?
So the 0 to 6 age group, and this is not summer, this is all the summer benefits have been issued. We're still doing some reconsiderations and some, some follow-up, some cleanup on the summer benefits. We are working right now to issue benefits for the 21-22 school year for the age group 0 to 6. And so those are essentially the child care children who are on a SNAP case. And so that plan was approved the 2nd of November. And we had already parallel to plan approval, we had implemented or logged change requests. So the system changes were moving along with the plan approval. Those benefits will be issued before December 31st. Hopefully middle of the month, but definitely before the end of December. And it looks like it's going to be approximately 40,000 children and about in the range of $12.7 million total benefits to that age group. And again, it was $35 for, for the fall semester. So fall of 21 was $35 a month per child. And then $37 a month for the spring semester per child. And that'll be issued at one time on the SNAP. These are all, again, children in SNAP who were on SNAP cases at that time, that month of eligibility. And so it's essentially a reimbursement of their SNAP benefits for that month. And so for that given month, it'll be issued to the SNAP card for the household, to the household for which they were a member. And so that's the update on that. What was, the 22-23 plan, we're working on that. We have not submitted that yet. I don't think, and we're not alone in that. There's been guidance, and I think there's a webinar later this week with FNS and the child nutrition group, both the SNAP and child nutrition group with FNS to talk about that plan and offer guidance and technical assistance to states in development of that plan. So that's ongoing work, but we are committed to doing that. And that'll include summer benefits too, once we get that plan approved.
Great. Well, then rounding out our mini agenda here and also reflecting some of the comments about how it's becoming, increasingly difficult to get through the call center caseloads. We're staring down increased caseloads next year after the public health emergency ends. So any comments that you wanted to make as far as what the cabinet's doing to improve the call center? I know that y'all are working hard in various ways, but also how the SNAP connector functionality should hopefully alleviate some of that by allowing folks to more easily get enrolled and deal with requests for information.
Yeah, we're looking at options to add call center staff, non-merit staff, options to add non-merit staff to help with the services that they can help with. There's prohibition on doing anything connected directly to eligibility determination as far as SNAP goes for non-merit staff. And there's pros and cons to that we could debate. But it does tie your hands in contracting out, certain job functions. But where we can, I know we're in the process of looking at the unwinding and adding staffing to help with some of those functions. And then as far as the connector role, we have that was developed and training was started for that back in the summer. Let's see, I should have some numbers here. And so some of the the Medicaid connectors, in fact, I think all of them have been trained. And those that have, for which we have a current financial agreement, they've already begun taking applications. And so this connector access, it allows agencies to basically, it gives them a view into the self-service portal to assist SNAP applicants in navigating self-service and making that, initiating that application. So that should be very helpful. And as you said, Tyler, that should help, individuals who are challenged in navigating self-service. I would probably be one to get that help they need to get that application initiated. So we have, as I said, we have agencies already started taking those applications that we have agreements with. And we have a non-financial agreement in development. It is actually with OLS, the Office of Legal Services, CHFS, Office of Legal Services, in the review process right now. My understanding is that is the last step for approval, and then we'll be able to begin to initiate those, execute those with these other agencies. I think you have an agency with an interest there specifically, Tyler, so that'll be the last step for that group to get the access and begin doing that work. Commissioner?
Yes. Thank you, Todd, and thank you for this. I appreciate being here. I just want to give the context. It's DCVS is 600 to 700 staff down. We have stopped the bleeding in regards to people leaving. But like every other partner and every other agency in the state and nationally, we are having a very hard time recruiting staff. So we are doing the work that we're mandated to do with an increased request for our services with 600 to 700 staff positions missing. In addition to that, we needed and have planned on an additional 200 to 500 staff to add to do what we needed to do. We have done several things. One is we just got the approval to make that position for the call center 100% virtual to be able to retain folks. And we have about 50 applicants that have applied once we did that. 2, we have increased the salary. 3, we're offering job flexibility in regards to when people work. And 3, a very robust recruitment campaign so that we can go ahead and get the folks that we need to do the work. So the storm is decrease of staff, inability to hire new staff, and increase in volume of calls. So it is it is a very difficult situation for us. We do have problem-solving groups with staff trying to figure out what's the best way to mitigate the calls, but I wanted no excuse. It's just the reality of what we're dealing with. We have had, as a result of the recruitment and the changes, a little bit better moving the needle on family support, which is part of what Todd is talking about in all these services. But we are not having much luck with our social workers, our protection and permanency, and we are looking at what we need to do about that. So if you know anyone that's looking for work, it's a new day. We have a lot of flexibility. We have a lot more inclusion of our frontline staff in the problem solving process and in this telling us what the work needs to look like. But really hang in there with our workers, and because the reality is that they're carrying the load for a large chunk of our staff that's not there. So our job is to make sure we hire good people and we train them and we get them in, and that we support and care for the ones we have so that they don't leave. And we are doubly committed to both of those. However, it's taking time, and it's going to take a little bit of time. COVID changed everything: the work space, the environment, the choices that our staff have, the choices that everybody has. And we, like everyone else, is suffering greatly as a result of that when it comes to workforce capacity. So thank you for listening to that.
Commissioner, I'm really glad that you joined us and that you could provide that additional context. You you and other leaders at the cabinet have been really, really transparent about this issue and about the process that you've been going through. And we appreciate that so much. And just to add additional context, we've, of course, talked about House Bill 7 for months now since it was, introduced in the legislature and then passed. And as we were fighting that bill, one of the things that was most concerning to us was that it would add additional paperwork and more administrative burden to the cabinet. And something that we're always trying to get across to legislators is that even if, the requirement is for a particular person, if it's harder for the staff to be able to process all of that additional paperwork to complete that process, then that means everyone is affected.
Right.
So we don't want to think about these additional requirements as only affecting a small group of people. It is system-wide.
Right. Thank you, Emily. And both House Bill 7 and House Bill 8 provide an incredible amount of additional administrative burden when we're dealing with natural disasters, COVID, a workforce capacity concern, and now more barriers for people to have to reapply more often for the benefits that they need and deserve, and creating barriers not only for our client, but the administrative burden for the staff that we need. We decided that to meet the new requirements and barriers that are in those bills, we needed an additional 200 staff to the 4,500 staff that we should have had to begin with. So it is an incredible challenge, and we advocated for our staff and for our clients as to what the barriers that this would present. Similar to what Tyler was saying, is how does it make sense to not bring money to Kentucky to help people who need it and deserve it? This was kind of those walls that we hit that we were not successful at. So, please talk to your legislators about administrative burden and unnecessary bureaucracy, and the fact that people need our assistance and that our staff is not capable of meeting mandates that are for the purpose of making sure people are worthy of services, as opposed to really getting at what people need and how to get those needs to people. We're public servants, we're not police, and we are incredibly challenged with both House Bill 7, House Bill 8, the additional requirements, the original certifications, and really a lot of what we've been able to do during the pandemic was be a lot more flexible and get services into people's hands, which is what we're supposed to do. And all of that has been taken away. So talk to your legislator.
Well, thanks again. We couldn't agree more. Of course, that administrative burden is just one more thing that is causing issues with people meeting their basic needs, and with the cabinet being able to, to administer all of these benefits that are so needed. I will say, if anybody's interested in talking to legislators, reach out to us. We can help you prepare for that conversation. And Commissioner, if you have any job postings that you want to put in the chat, please do.
Oh my goodness. I have so many job postings. I will go ahead and look at what the link would be. We have job openings in all areas, and we're beginning to narrow it down by counties because people want to know where it is that the jobs are. But really, if you're interested in working, it is a new day. It is better pay. There is a shift in changing our culture from, to one of inclusion and to one of hearing the voice of our clients as well as our frontline staff. We're nowhere where we need to be, but we really are transforming this dinosaur. And I will go ahead and the whole goal of this 21st century planning and strategy is to decrease barriers that increase access. So please be part of the transformation. I'll get you the appropriate places where you can see. You can go on the website for DCBS. You can look at personnel. We're all over the place trying to recruit. We actually are going to be hearing us on NPR. I'm just spending all kinds of money to be able to do a very strong campaign for us. So if you're interested, please consider and share with people that we're hiring and that really we're trying very hard to transform this dinosaur.
Well, thank you. We've got the link in the chat now. So thank you, Andrea. And yes, we definitely want to help in any way we can. I'm going to hand it over now to Dustin to talk about childcare.
Great. And I'm coming live from General Butler State Park right now, and somebody's dumping ice over here, so I apologize if it's noisy. So yeah, we're going to talk a little bit about childcare. I heard it said once that childcare is the industry that supports all other industries, and I think that's absolutely right. Unfortunately, childcare is not funded the way, say, K through 12 education is, and so it's really dependent on parents putting up a lot of money, and it is a lot of money. It's comparable to a 4-year degree tuition at Western Kentucky University, for example. So it's an expensive service, but it's a necessary service. And up until recently, it was a service that was in crisis in a lot of ways. We have about half as many children on the child care assistance program as we did 10 years ago. There's about 45% fewer child care providers than there were 10 years ago. And so it was really in a bad way. And then COVID hit, and there was a potential for a catastrophe. But the federal government stepped in and provided a whole lot of money, first through the CARES Act, then through CRISA, the December 2021 package, or 2020 package, and then finally through the American Rescue Plan Act, where over $760 million was provided to the state to provide funding for child care centers in a couple of different ways. One through sustainment payments that Andrea will talk a little bit about here in just a minute, and then another through more flexible opportunities. And the state has put those dollars to good use. And I'm going to invite Andrea to tell us a little bit more about what those uses have been, what the benefits have been, and then what's going to happen at the end of the runway there, which I think is anybody's guess, but that money is coming to an end soon. So Andrea, why don't you share a little bit with us?
Thank you very much for inviting me to come today. Like you said, childcare is the industry that, helps all other industries survive, because parents don't feel good going to work if they don't know that their children are safe and cared for and loved. So that's a common thread. As you mentioned, we did get massive amounts of money through 3 different relief acts. With CCAP, we've done a lot with CCAP over the past 2 years. And I'm happy to report that we have finally gotten back to the same CCAP enrollment as prior to the pandemic. That just happened in June, but we're there. And with the current CCAP reg, which had its second reading today with Health and Welfare and passed, we have raised the initial eligibility threshold for families. Prior to the pandemic, it was 160% of the federal poverty guideline. We upped that to 200% on January 1st of this year. And then we upped it again on July 1st to 85% SMI, which has been huge. And with those 2 increases, an additional 1,700 families have benefited from childcare, and that's about 2,500 children that are now eligible for CCAP that hadn't been prior to. So we're really excited to see folks taking full advantage of the program that we have. We also just did a marketing campaign, if you will, through our listserv with flyers for providers. We followed up with snail mail, copies of flyers for them to put up, showing families, here are the new income eligibility guidelines. You may never have thought you could benefit from this, but you might want to take a look at it, because again, we have vastly increased that threshold to make more folks eligible. And that's something that we're really, really proud of. We've also, with American Rescue Plan dollars, we have a lot of innovative programs that we are doing that we have received some national attention on. One of those being the transitional childcare, meaning when families are no longer eligible for CCAP, we are using ARPA money to pay 50% of their childcare for 6 months. We started out 3 months. We moved that up to 6 months. So far, 212 children have benefited from that, and that's 174 families as of last month. So, those are some families. the benefits cliff task force has been mentioned a couple of times. You know, childcare is one of those bigger cliffs, because if you've got 2 kids and you exceed the income, then you're looking at $1,500 that you're going to have to come up with next month, so your children are in a safe, loving environment so that you can go to work. So with the transitional childcare in mind, that is something, you know, again, we can't use regular CCDF dollars for the Child Care and Development Block Grant monies for, but we're trying to take lessons learned from this to look at what a graduated phase out, a true graduated phase out would be from the program, to where it would be gradual for the families, to where that economic impact wouldn't be as great to their overall household budget. Another thing that we have just done, again with ARPA funds, is the child care employee income exclusion. So as long as a family meets all technical eligibility requirements for CCAP, and they work in a regulated child care program, either licensed or a certified family child care home, all of their household income will be excluded from the CCAP application process. So that's a benefit that most providers can't offer their employees, or if they do, it's at their own detriment. So this is like a free benefit, if you will, that we're able to provide. And the Office of Child Care recently released a memo about ways to be innovative, and that was one of the things to do. And again, we've had Michigan reach out. We were highlighted in Workforce Wednesday by the Office of Child Care for really being on the cutting edge and really thinking differently about how to tackle this issue. One of the other things that we have been doing with CRSA dollars is paying family co-payments. Unfortunately, ARPA money cannot be used for that. So those are getting ready to come to an end in January. That will be a new expense for families. However, we did increase. I say increase, my staff say decrease. It's a bigger number to me, so that means more. But used to, it was if your family had $900 a month in income, then you would be assessed a copay. That's now $1,400 a month before they're assessed a copay. So it is a benefit to the family. That's more money that they get to keep in their pocket. We are getting ready to switch from paying CCAP based on attendance to enrollment. That is something we had done with CARES and CRSA dollars before. We're switching back to that December 1 for the service month of November because CCAP pays a month behind. So we're ramping up to do that. Again, that will benefit providers in that they will be paid for the slot. So we're excited about that. And that was something that we heard at the state administrators meeting. It's not a requirement from the Office of Child Care, but in every session that I attended or my staff attended, it was strongly suggested to look at paying on enrollment versus attendance as a way to help sustain current capacity. So we'll be keeping a close eye on that as we move forward as well. With the ARPA payments, there was, $470 million just for sustainability payments. We have issued 5 of those payments so far to the tune of about $248 million. And we have 4 remaining payments to go out, the last payment being in September of this year. So 1,722 providers have benefited from those sustainability payments. You know, we are required to report out on those quarterly to the feds. We did make the decision to ask our providers to fill out monthly data sheets. That way it wasn't as cumbersome every quarter with the same date. That way we know where that money is going and making sure that it's for an allowable expense to be good stewards of the money for any federal audit we may come under. The other bucket of money, which was $293 million for one-time funds, we kind of threw a little bit of everything at that money. We did a series of startup grants. It was a $100,000 matching business grant for businesses to start a program. Unfortunately, there's not been the interest that we had hoped. We've only had 3 applications, and that was in 2 different counties. We also had the Child Care Desert matching grants, which were up to $100,000. We have issued 22 of those. We have issued 882 facility repair grants, and that was for any regulated provider could apply for up to $10,000 to make improvements to their program that was related to health and safety. And, you know, that's a pretty broad definition of use of how it relates to health and safety. But, you know, our providers, they have taken us up on that. And we hope that many more will, because that's about half so far. One of the other things that we have done is family childcare startup grants, because as you all know, it's really difficult to stand up an independent childcare center, especially in our more rural areas. So with family childcare, those are smaller, 6 children, 10 if you're caring for related children. So we offered startup grants for them, and that was a continuation of some work we had done with the Kellogg Foundation and the Pritchard Committee, looking at ways to improve infant and toddler care across the state in family childcare homes. So we continued that. We started out issuing $2,500 startup grants, and we just increased that to $5,000. And we made it fair to everyone. So all those that had been approved at the $2,500, we issued a new agreement with them and gave them that additional $2,500. That way the playing field is level, and what we've done for one, we have done for all. All of these startup grants, the application period ends December 31st of this year. We will be extending the family childcare startup grant for sure. And then we are meeting as a group to start talking about ways that we can use the money that we had allocated for the business partnership and desert grants in a more appealing way, if you will. You know, what can we do to make folks want to buy it? So we will be having those conversations. Another one of the programs that I find just fabulous is we partnered with the Kentucky Higher Ed Authority to offer scholarships. And that is for those who work in a childcare facility to get their credential, a certificate, associates, bachelor's, all the way up to their master's. We have issued 672 awards so far, and that's $1.4 million as of yesterday. That's to 429 individual scholars. And 22 institutions of higher education are participating. And it's been a pretty even split, with 51% being public universities and 49% being our community and technical college system. 13 out of the 16 community and technical college system are participating. We had some in Southern Kentucky and Eastern Kentucky that haven't, but I mean, I consider that a great success, and that we are really reaching every corner of the state with those. 72% of that higher education is towards associates and bachelor's degrees. So people are really improving their professional development and their earning power, essentially, as they go on. Some of the other things that we kind of have in the works as well, we are looking at expanding professional development through an infant and toddler and an after school age credential as well. So, you know, we're trying to be very mindful, because childcare, for lack of better words, it's been neglected. Like, everybody knows we need it, but nobody wants to talk about it. And nobody really has considered the discrepancy between childcare and, say, a public preschool or whatever, and the discrepancy in pay. So we're really trying to shine a light on what critical work is going on and really elevate the profession, and really change the way folks are talking about childcare. that is kind of us in a nutshell. I know I kind of went through that fast, but I'm trying to be mindful of time too.
No, I really appreciate it. There's like, just anecdotally talking to our childcare center, they've used a lot of what you've talked about, including using the childcare staff benefit for CCAP to both recruit and retain folks. So there's been a lot of really good stuff. I think we've got to move along to our next agenda item, but Andrea, if you could stick around, we've got a couple questions in the chat that we can go back and forth on here in just a minute. But I'm going to go ahead and transition us over to our next agenda item, which is with Vivian. Vivian, I think is on the call with us here. Yeah, Leslie Bibbs. So one thing that I've really appreciated about CHFS over the last several years is a really explicit commitment to health equity throughout all programs. And one aspect of that we've seen pretty consistently over the past is a minority health status report that looks at a lot of different data sources to try and illustrate what's going on in the state as far as our well-being across racial lines. So the last time that full report was put out was in 2017, but we are finally back with it. And there's a report forthcoming, and there's actually an executive summary that's already up on the website that has a lot of really good information. So we've asked Vivian to come on and very briefly describe what's in the executive summary, talk about plans for the full report release, as well as any sort of supplemental components to it. So Vivian, why don't you share a little bit with us?
Sure, thanks, Dustin. Good afternoon, everyone. So the Minority Health Status Report, as you know, was not published as we were going through the pandemic. So we have that gap. So we try to explain that in the full report a little bit. We try not to delve into the COVID numbers because we have a complete web page and links to different CDC reporting and our numbers for immunization and KYR. So the Minority Health Status Report will not be a duplication of the numbers that you can find regarding our numbers for the pandemic. But what we do have is all that other information that you kind of have to pull from different places. The Minority Health Status Report is that one place where we're hoping that you can find all that information readily available at your fingertips through the report. So one of the things that we try to do repeatedly is to make the report different every time we put it out there. We want people to say, ooh, what's in it new this time, versus it's the same data that we always see. And we've had those reports, right? I have an office now of bookshelf of just reports that look very much the same, just different years attached to them. So we wanted the Minority Health Status Report to look a little different. So we try to reinvent it every 2 years. So it's a biennial report that we have to put out by protected statute. And in that report, we look at some demographics. We look at where our populations are across the state and their physical geographies. We also look at some social factors. We look at some health risk factors. We also look at other things such as home ownership, some things that we know are tied to poor health outcomes, which is not being insured, lack of education, housing, renting versus owning. If you own your home, your health outcomes are should be much better than if you rent. So we look at things like that. And we package all of that into a document that we try to keep the pages down to a 30 or less. We've done that this time again. We're proud of that fact. Now, I say that to also say that we had so much rich data that we have a supplemental report that's going to come out with all that additional data that we didn't put in the final report. Our secretary wanted it to be something manageable that our cabinet and Kentuckians and legislators would read. And he wanted it to speak like with one voice as to what the cabinet conversation is like around racial and health equity. So we're all singing on the same page, using the same definitions, the same language, et cetera. So we're pretty proud of this. The final report should be out soon. The secretary still has his eyes on it. So when he releases that, it will be on our webpage. You can find the executive summary on the Office of Health Equity webpage. And then at the end of the summer, at the end of the executive summary and the final report, we always wanted to offer up recommendations as to how we can address health inequities within our state. So we list some of those things as far as maybe looking at existing policy and processes, which we're doing internally, by the way, as a cabinet. Are we being equitable in our procurement and in our hiring processes and in our other ways that we do business? And we're looking at that within DPH and cabinet-wide. And then we're also going to be looking at racial equity and health equity and the impacts that it's having on our populations across, on our different populations across the state. So we are making recommendations that we look at those little P and big P, little policy and big policy. We're also looking at what we need to do as far as hiring. We believe our workforce should mirror the population that is in our state. We know that there's some areas of our workforce. I think Marcia just said that, Lord have mercy, the vacancies that she has and the vacancies that I currently have, we know that that could be filled with a little more, there could be some diversity there that maybe we don't have. And not just in race and ethnicity, but diversity across all of the areas. So we make those recommendations about hiring practices, about how we're having those conversations. I will say, and I tell Dr. White this all the time, if there's any one good thing that came out of COVID, it's that it kind of pulled the Band-Aid off some of these inequities we can't ignore anymore. So we're having hard conversations that maybe we never had before around racial equity, around health equity, around some of those social injustices. We're not necessarily leaving the social determinants of health. We still talk about them, but we're moving upstream now, looking at root causes. Because that's the conversation that's happening across the country, and Kentucky is no different. We're looking at some of those root causes, those institutional and structural and systemic barriers that have marginalized groups over time historically. So we're making those recommendations that we still have those conversations. We're looking at literacy and language and some of those other things in our recommendations. So I won't take up any more time, but just to tell you to go to check out the executive summary and stay tuned for the full report. Thank you, Dustin. Appreciate it.
Vivian, thank you. We're really excited about the full report if it's, even half as good as the executive summary. So I appreciate it. And I'll just use this as an opportunity as a teaser. We'll have another forum with the cabinet in February. And I think by then the full report will be out. So we'll try and use up more of our time going through all of it. So we'll have you back, Vivian, if you're willing.
Okay.
Awesome. Great. Well, I'm going to hand it over to Kelly to talk a little bit about flu, RSV, and COVID season.
Yeah, and I'm just going to be very quick. I would like to introduce to you Dr. Connie White. She's the Deputy Commissioner with Kentucky Department for Public Health. We are a little pressed for time, so she's going to speedily talk to us about flu, RSV, and COVID-19. But I think we can all agree you would be pretty hard pressed to find a family physician, pediatrician, hospital doctor, parent, teacher, any of us who are not a little concerned about the skyrocketing rates of pediatric hospitalizations and what that means for our children right now. So Dr. White, I will hand it over to you.
Thank you very much. I hope no one got seasick over that, but I was trying to pull this up. So when Kelly turns this over to me, yes, we spent a lot of time, as Vivian said, putting lipstick on this pandemic pig. I think there have been things that we have learned. And if we don't use this as a growth experience, well, shame on us. So I'm going to go right into this. You will have these slides. So everybody always asks, are you going to have these slides? Yes, your Thrive team will have these slides because I'm going to blow through these and show you links. And so these links are live. So when you get these slides, you can go right to them. I'm going to hit the high spots and then give you an opportunity to look at these. So this is a flu report. It is on our website. I believe every Friday it is posted that you can find this. And I immediately realized I don't have a link there. Oh, yeah, there it is. There's the flu report link right here. So this is kind of a conglomeration of what's on that website. But the most important thing is red is bad, red is widespread, and every county in Kentucky is having increasing activity. This is the piece I wanted you to see more importantly. This is looking at ILI, influenza-like illnesses that are reported to us. That green line down there, that was 2021. And if you remember, we didn't have a whole lot of flu in the 2021. So we are looking at, it starts the middle of September and it goes into the spring. So those are those weeks down there. Those are weeks of the year. So 2021, we were in still a little bit of healthy at home. And so there were a lot of people staying at home, a lot of people wearing a mask, a lot of hand washing, a lot of care, a lot of not big meetings, not a lot big activities happening. And our flu was, our ILI was very, very low. If you look at the turquoise one, that is right before COVID happened. And if you look at this little purple doodad line down here, that is now. And so you can see we are way ahead of our flu cases that we're having in Kentucky. I don't think that's a surprise to anyone. If you listen to the news, you hear about RSV, you hear about flu, you hear about COVID. We have had one death from influenza that's been reported so far this year, and that was a combination flu and COVID situation. So go to the website. You can look at it every week. You can know exactly what is happening as it's reported to the Department for Public Health. If I knew how to tweet, I would have given you a more updated version of this. But since I don't tweet, this is the slide that we used last week in a presentation. So this is November the 8th. But the Kentucky School Board Association tweets out what school districts are closed. That's not reported to us at the Department for Public Health, but the School Board Association keeps up with that. So you can see as of November the 8th, that was roughly 106,000 students were impacted. This is a combination of respiratory illnesses. There's a lot of it going around. Kids are back in school. People aren't masking and they're forgetting to cover their cough. I mean, we're not talking rocket science here. Cover your cough, wash your hands, stay home if you're sick. I think that's the next slide. This is actually a tweet. And in a minute, I'm going to show you a website where you can go and you can get copies of these tweets if you want to tweet them out to your organizations. But stay home if you're sick. That makes sense. Wash your hands, cover your coughs, get vaccinated, get boosted. I can't tell you how many people have said, well, do I really need to get that bivalent, the one that's specifically designed to go against Omicron? Well, yeah, you need to get that. And so getting up to date with that Omicron bivalent is very important. And what's not on here is masking. Use masking as it is appropriate. I have my mask right here. I wear it in my building. I have rheumatoid arthritis. I'm on an immunosuppressive drug. I don't leave my desk without my mask on. I have a 93-year-old mother. I am protecting myself from RSV and flu and from COVID. If you're going to a big event, you may want to think about masking. Just think about where are you, what setting are you in, and are there going to be a lot of people in close proximity with respiratory droplets, and you can make those decisions on your own. But masking has been around for decades and it does work. This is some information that is from national data. So this is 6 months to 17-year-olds. This is vaccination coverage, and this is looking at race and ethnicity. So this top line here is from last year. The turquoise is national, and the yellow is Kentucky. So that shows you what our vaccination rates in the young kids look like. The red here is national and the dark blue is Kentucky. Here's the link. Look at it at your leisure, but it kind of stinks for us this year. Looking at 6 months to 17-year-olds, again, this is breaking it down by race and ethnicity. So the purple line is U.S. Hispanic, the orange is white, and the green is Black Americans from last year's flu season. You really can't, I don't know who picked these colors. We didn't. This is a CDC slide, but these colors down here are Kentucky looking at Black, Hispanic, and white. And so if you pull this up yourself at this link, you can actually make that bigger and you can actually see it and know what's going on there. But again, we are the target Healthy People 2030 is 70%, and we're not getting even close to that. This is the one I want to be sure and go over. This link right here, critically important. People don't know where to go to get vaccine. If you click on vaccine.gov, it's a real, why is that? Oh, there it is. It's simple enough that I, who is technically challenged, can do this. So you find vaccines and boosters, you go in and put your zip code. That's where I live in Frankfurt, and you hit that. I want updated ones, and this will show me every place where I can get an updated vaccine. I'm just going to pick this out of the air, and it will search for where those vaccines are, and it will show me a map. And I can click on here and see if the Franklin County Health Department has availability. Some of them will actually have links where you can go on. Let's just pick this one right here, which is right down the street from me. I happen to know this is where I got mine. They don't have a computerized system. You have to call and make an appointment at Capital Pharmacy. So that wasn't the best one to do. Let's go to Kroger's here. So you can check for appointments. Some of them you can actually go on and make your appointment. So you can find out, do they have vaccines for you? You can then look for flu vaccine. It's the very same process. You put in your zip code, you tell them what kind of flu vaccine you're looking for, and then you hit search for vaccines, and you can actually go back to, you can find out where in your area you can get this vaccination. Now, I don't know how to get back to where I was. This is interesting. I guess I'll stop sharing. And then I'll share again because I'm messing this up and I'm going over time. So I'm going to just show you 2 more slides. I don't think this is going to work. Okay, so let's just stop sharing, which is too bad because the next thing that I wanted to share to show you was pretty interesting as well. But what I was trying to show you is how you can go on to our website where we have a vaccine resource. Yeah, I can do it. Y'all aren't seeing that, are you?
I'm not sure what's happened, Dr. White, but
No, we were seeing the website and it was really cool. That was very helpful.
Okay, well, the website is cool, but I'm trying to show you right now how to get to our website on ky.gov, and it actually shows you how you can find these resources that I was talking about. And so it gives you an option to do tweets, to do I'm not going to worry about how it looks fancy. There we go. This is what I wanted you to see. So this is if you go to this, and this is a live link, and down here, it gives you all kinds of information. There's a toolkit for flu and COVID. There's graphics that you can see. And this is a wonderful job. All of these people, including the Foundation for Healthy Kentucky, the Kentucky Voices for Health, all these folks have agreed to do a whole bunch of real quick things that you can use on your website, on your Facebook, on your Twitter, on your whatever stuff is that I don't understand. But we've got a whole host of these, and I just pulled up 3 of them that I thought were kind of cute. So these are all available. Go to that website, pull some of these off and share these with folks. And this is my information. What I was asked to talk about also was the vaccines for children. And if you come in February and I'm re-invited, I will be happy to talk about vaccines for children, because that's a whole topic that is critically important. And if this group doesn't know a lot about that, we really need to share that with you. So that's as quick as I could get through there. I'm so sorry, but there you are. And I'll answer questions that in writing as people bring those in, if there are any.
Thank you, Dr. White. We gave you an impossible task. And thank you everybody for sticking with us. We will be following up with all of the links, all of the resources, with the slides, and great teasers for our February forum. So you have a little sneak peek preview of what our agenda will be. So you'll get that follow-up email tomorrow, and please just stay connected with us. And thanks again, everyone.
Thanks, Emily.
Bye. Thanks for coming.